The Assembly Committee on Government Affairs will come to order. Madam Secretary, please call roll.
Assemblywoman Anderson. Assemblywoman Black. Assemblywoman Brown May. Assemblywoman Considine. Assemblywoman Dickman. Assemblywoman Duran. Assemblyman Ellison. Assemblywoman Martinez. Assemblyman Matthews. Assemblyman MacArthur. Assemblywoman Thomas. Assemblywoman Torres. Chair Flores.
Present. Thank you, Madam Secretary. Please let the record reflect all members are present. We have a quorum. Members, I'd like to remind everybody to make sure that you're not logged in on Zoom if you're sitting in the committee room. I think by now we all know that, but I just wanted to make sure so that we don't create any chaos behind the scenes for our staff. For those of you who intend to testify today, I want to remind you to please state your name after each question. It's not so much to help us, but more importantly to help our staff who are taking minutes and often are not watching the same video that we are. I want to remind those of you who are present that when we are testifying in support, opposition, or neutral, we'll start first with the folk that are here present in person, and then we'll make our way to the phone lines. In addition to that, I want to remind folk that as we're moving forward with the Senate bills, we intend to try to stay as light as possible, but as we start getting towards the end, we may have to change the start time as always. We don't anticipate that as we don't have such a heavy load from what came over from the Senate side, but I just want you to be vigilant always with the 9 o'clock start time. I know some of you texted me this morning that weren't sure if it was a 10 or 9, and I apologize for that confusion. For the most part, typically Tuesday through Friday we will be starting at 9, and because I know a lot of folk fly in on Monday mornings and or we're late with their families, I try to start later on Monday mornings. So that will be the routine we'll try to follow, starting a little bit later on Monday mornings so that you have an opportunity to be a little bit longer with your families, but then the rest of the week we'll start at the regular time. This Friday we won't be meeting, as a lot of you are aware, so that for those of you who wish to be at the service, you'll have an opportunity to do so. With that, we'll go ahead and move over to our agenda. We'll take it in the order it appears. I do see Senator Pat Spearman on the monitor. One last thing that I forgot to mention, members, as we're now back in the committee room, and those of you who are here present, I want to remind everybody to silent your phones. We got so used to Zoom, but now we're back in the regular routine of silencing our phones and doing that. I think in a different committee we had our first fun incident of a phone going off. So with that, we'll go ahead and open up the hearing on Senate Bill 109. Senator Pat Spearman, whenever you're ready.
Thank you, Chair Flores. Good morning. Committee members, I'm here today to present Senate Bill 109, which would require state agencies to collect sexual orientation and gender identity, or SOGI, data like other demographic information such as age, ethnicity, income, race, and etc. The requirement includes an option for individuals to decline self-reporting SOGI information to a state agency. Let me say that again. The requirement includes an option. In other words, you do not have to give that information if you do not want to. You don't have to relay that to any state agency. Excuse me. Overall, general data pertaining to the lesbian, gay, bisexual, transgender, and queer plus community across the nation and in the state of Nevada is becoming more readily available. However, that information is often fragmented. We have learned from research that LGBTQ plus community suffers disproportionately from negative health outcomes such as depression, cancer, high rates of smoking, and comorbidities, to name a few. Just recently, the Williams Institute, a think tank at UCL Law School, excuse me, released a study about the disproportionate impact of the COVID-19 pandemic on the LGBT plus community. Further research illustrates individuals who dare to challenge traditional ideas of gender identity include those who identify as transgender. They also face employment and housing discrimination, assault, and sometimes even murder. Let me say at the outset, this bill does not require anyone to change their religious ideology, their social strata, their church affiliation, It does not require any of that. Often when a bill or an idea related to the LGBTQ plus community is introduced, I hear statements reflecting personal canonical doctrines or beliefs. So let me just be clear again. This bill has nothing to do with religious ideology or philosophy. In Nevada, specific data that references the well-being of the LGBTQ plus community and strategies for scaling up and interventions to address growing needs is not currently available. By collecting SOJA data, we can better know the number of LGBTQ plus Nevadans in the state, the outcomes of social determinants of health, and how the institutions that Nevadans expressing diverse sex and or gender identities turn to for help, how they're able to support them by providing services and information. For more than a decade, LGBTQ plus advocates in Nevada have been pushing healthcare providers, nonprofit organizations, schools, and state agencies to collect data on sexual orientation and gender identity. Last year, the state of Nevada's Department of Health and Human Services made it a practice to collect optional SOJI data during the contact tracing for COVID-19. In a memo to the Advisory Committee for Nevada Office of Minority Health and Equity, Director Richard Whitley stated that, and I quote, "The department is committed to greater data stratification across all vulnerabilities, abilities, and demographics, including those reflecting sexual orientation and gender identity. Some other state agencies are already collecting SOJA data, but the effort is not consistent and it is not standardized. The most crucial components of Senate Bill 109 are found in Sections 2 and Section 4. Section 2 of the bill defines a government agency as any state or local government office. Section 4 requires a governmental agency to collect SOJI data, to maintain confidential records of the information, and use the data for certain authorized purposes. These purposes are limited to demographic analysis, coordination of care, improvement of care, improvement of services, conducting research, and fulfilling reporting requirements for federal or state law, or informing policy or funding decisions. Section 4 also requires a governmental agency to submit an annual report with summary of information to the Director of the Legislative Council Bureau on or before December 31st. It's important to note that individuals still have the option to self-report their sexual identity and their gender identity. It is not mandatory. Let me say that again. It is not mandatory. Some of you may remember Senate Concurrent Resolution 1 from the 32nd special session in 2020, which urged proactive efforts to stem the public health crisis resulting from systemic racism and magnified by the COVID-19 pandemic. And Mr. Chair, I understand that when we start talking about systemic racism, it makes some people uncomfortable. And for those who have experienced it all of their life, trust me, it makes us uncomfortable as well. But we must have these courageous conversations. Senate Bill 109 is a continuation of that mounting effort to curb economic, health, and social disparities also experienced by Nevadans who identify as sex and gender diverse. Collection of demographic data is how data is made meaningful, given the immense underreported, underacknowledged, and misunderstood suffering and the needs of the sex and or gender diverse population. Many have expressed favor with this proposed measure. I don't believe that the bill has any fiscal impact. And if it does, I have some information here from a couple of people who do this sort of thing with computers and analytics, and I'll be glad to share that if the question is asked. Just before I turn it over to Mr. Andre Wade, I just want to say this, Mr. Chair. Many times members of the LGBTQ community are ignored, often dismissed, and sometimes spoken in pejorative terms. But the one thing that I want everyone who is listening, to include those who are listening over the internet, to understand, when we collect this data, it will inform policy, both in terms of healthcare, in terms of employment, in terms of housing, and everything else. It will inform how that policy is developed. And I stressed at the beginning of my testimony that it has nothing whatsoever to do with someone's religious affiliation. I'm not sure how many know this, but I am a graduate of the Southwest Texas Episcopal Seminary. So I studied 3 years in religion, all kinds of religions, all kinds of spirituality. And I checked all of that, and this has nothing to do with that. The other thing that I would like to say and get on the record is that members of the LGBTQ plus community in Nevada pay taxes. We have cars, we pay taxes on that. If we buy gas, we pay taxes on that. And those taxes go to keep the roads functioning and to repair the roads and to expand the highways. We pay property tax, and those taxes go to support our schools and school districts. The bottom line is this is a community that currently is underrepresented in the statistics that are reported, and we've got to make sure we find out the exact number or as close to that as we can, because there are many, many opportunities to apply for grants, not only from the federal government, but there are philanthropic grants that we could apply for. And the one thing that they will always ask is they will ask for the demographic data that to support your request and who it is you will be helping. So I want to turn this over to Mr. Andre Wade. And again, I say this bill has nothing whatsoever to do with anyone's religious ideology or philosophy, your church affiliation, nothing whatsoever to do with that. If you want to look at it, excuse me, in concert with what we already do, we try to collect data on autism. We collect data on Alzheimer's. We collect data on kidney disease. We collect data on the number of college students. We collect data on the number of seasoned citizens, those who are 55 and over. And so this is just another opportunity for us to make sure that the demographic information we have on Nevadans is whole and complete. And with that, Mr. Chair, with your permission, I'd like to turn it over to Mr. Andre Wade.
Please do. Thank you.
Thank you, Senator Spearman, and good morning, Chair Flores and Vice Chair Torres and members of the committee. My name is Andre Wade, and I'm State Director for Civil State Equality, a Nevada-based statewide LGBTQ plus civil rights organization. As Senator Spearman mentioned, overall, there's a lack of data about those who identify as lesbian, gay, biromantic, transgender, and queer.
Excuse me, I apologize for interrupting you. If I could just have you speak up just a little bit more. We're having a little bit of a difficult time hearing you. My apologies for interrupting you.
Okay. No, you're all good. I want to make sure you all hear me. Thank you very much. So again, overall, there's a lack of data about those who identify as lesbian, gay, bisexual, transgender, and queer in Nevada. Therefore, it is difficult to determine the number of Nevadans who identify as LGBTQ+, their health and well-being outcomes, and what interventions are successful to address social determinants of health. Moreover, because we don't know the number of LGBTQ+ Nevadans, we are unable to scale interventions appropriately and effectively. Often, the reason for the lack of data is simply because the questions aren't being asked. SODI data has, as we refer to it, is important because we know that when someone identifies as LGBTQ+, they have different social determinants of health and particularly risk factors that are different from others. Even someone's actual and perceived treatment and care when accessing services plays an unfortunate role. On almost any measurement of positive outcomes, those who identify as LGBTQ+ are at the bottom of those measurements. On almost any measurement of negative outcomes, those who identify as LGBTQ+ are at the top of the measurement. And if you factor in race, then many individuals experience compounding negative health outcomes. Because we don't collect SOGI data, we are unable to address these health disparities we've come to estimate based upon national studies. The national data gives us a sense of what is going on with the LGBTQ+ population, but we desperately need to know what's happening in Nevada. A recent report on census from the Census Bureau shows that Nevada is one of 11 states plus the District of Columbia, which had a higher percentage of same-gender couple households than the national percentage in 2019. Unfortunately, we don't know with this data the number of individuals that identify as LGBTQ+, but we are able to get a snapshot of what rates of unemployment looks like for the same-gender households, what education obtainment looks like, and how many are veterans. But we are left, as we usually are, making inferences about the LGBTQ+ population as a whole in Nevada. We are still left in the dark about a population of individuals that make up 8% of Nevada's total population. Most recently, with HIV criminalization, we try to find out the rates of disparities for arrests, convictions, and prosecutions for those convicted of HIV crimes. And because we don't collect the data on LGBTQ plus members of the community, we're unable to make those determinations. And we had to see where there was a point where someone checked a box for male and female, and we had to guess that maybe that someone was transgender because we simply don't know. Thankfully, the Nevada Office of Minority Health and Equity, of which I'm a member of the advisory committee, plans to release for the first time limited data gathered for its 2020 Minority Health Report that will include data on the LGBTQ plus population. The data isn't perfect, and there will be improvements done for 2021. However, this is a step in the right direction to not only collect the information, but to also report out on it. Moreover, the Nevada Department of Health and Human Services made the decision last year to start collecting SOJA data when contact tracing is being done related to COVID-19. This makes Nevada one of just a few states taking leadership in ensuring that SOJA data is collected so that we have a better understanding of the rates of diagnoses and outcomes of Nevadans who have been diagnosed with COVID-19. Referring to SB 109, there are two key components that I'd also like to hone in on. One is that it is optional for someone to respond with information about their identity when asked. That's very important to know. Another key component of the bill is that someone cannot be denied services for not responding to the questions. Everyone will be asked when demographic information is already being collected, and everyone can decide for themselves as to whether or not they will respond. Not only will the SOJA data help the state to better coordinate services, scale interventions, and improve the health and well-being of LGBTQ plus Nevadans, the increased data can be used when applying for federal grants, because when asked about the number of LGBTQ plus people served or the community's health outcomes, we'll have more specific data. Increasing the number of federal grants awarded within the state of Nevada is a long-standing and achievable goal. SOJA data will undoubtedly position the state of Nevada to be better prepared to report out on the number of LGBTQ plus Nevadans and other data points when applying for federal grants. Regarding cost of systems to collect SOJA data, the Massachusetts Department of Mental Health reported that there was no fiscal cost to them to make changes to begin to collect SOJA data. They were able to change the application using Adobe Acrobat. Additionally, they were able to make changes to their mental health information systems module by configuring in-house. And they serve about 30,000 people per year. So thank you for your time and attention today. This ends my testimony. We can turn it over to Dr. Conwell.
And thank you for joining us this morning.
Hi, good morning. Members of the Assembly Committee on Government Affairs, Chair Flores and Vice Chair Torres. My name is Kareth Conran, and I'm the Research Director of the Williams Institute, the research center at UCLA School of Law that Senator Spearman referenced. We conduct independent, rigorous research to inform law and public policy. I have been studying sexual orientation and gender identity, SOGI, and how to gather data about LGBT people for the last 20 years. I started at about age 12. That's a joke. But I have been doing this for quite some time. It's my pleasure to be here today to testify on behalf of Senate Bill 109 in support of SOGI data collection in local and state systems. There are 3 points that I'd like to make today. We know how to ask questions about SOGI. Number 2, people know how to answer questions about SOGI and they're willing to do so, including in the state of Nevada. And I'll give you some examples. And number 3, Nevada needs these data to effectively plan and implement programs and services. On the point about asking questions about SOGI, questions about SOGI have been on federal surveys for the last 2 decades. Surveys like the National Survey of Family Growth, the Behavioral Risk Factor Surveillance Survey, the Youth Risk Behavior Survey, and they have been more commonly included on other publicly funded surveys to identify trans people for the last 7 years. We have published best practices at the Williams Institute for SOGI data collection, focused on trans populations and also sexual minority populations. All of the research shows that SOGI can be measured accurately. On point number 2, Nevada youth and adults know how to answer SOGI questions and they are willing to do so. In 2019, almost 15% of Nevada youth self-identified as LGBT on the Nevada State Youth Risk Behavior Survey. Now, that was the only information available about LGBT youth in the state of Nevada. But looking at data from the YRBS from other states and in the nation as a whole, I can tell you that 6% of straight youth attempt suicide in a 1-year period. A quarter of LGB youth attempt suicide in a 1-year period, and over a third of transgender youth attempt suicide in a 1-year period. Suicide disparities have been observed among youth along SOGI lines for decades. And I am certain if you looked in your data in Nevada, you would find similar patterns because they persist everywhere. Suicidality is a significant issue for transgender folks. About 40% report a lifetime suicide attempt. It is not because there is anything inherently wrong with people who are transgender or sexual minorities, but the evidence shows that it is discrimination, harassment, and violence that lead to elevated rates of mental health challenges and suicide attempts. And that environments that are supportive and free of abuse, harassment, and rejection, people do just fine, and these disparities disappear. In terms of adults in the state, between 2015 and 2017, 5.5% of Nevada adults identified as LGBT. How do I know this? The Gallup Daily Tracking Poll collected anonymous telephone survey data from people all across the country, which allows me to say some things about people in the state of Nevada that have not really been accessible to folks in Nevada itself who are trying to plan programs and services. Unfortunately, Gallup is not collecting these data anymore, so it's really essential for the state to step up and make sure that SOGI data are collected in all of your vehicles, your YRBS survey, your behavioral risk factor surveillance survey, and in your service delivery systems. You need these data in order to effectively implement programs and services. Having worked in the state of Massachusetts for 2 decades and in the state of Boston, I can tell you that Boston started collecting SOGI data about 20 years ago, and the state of Massachusetts has been rolling this out for the last 5 to 7 years. It does enable effective planning, and as Andre said and Senator Spearman, it does position the city government and the state government to apply for block grants, which is so helpful given elevated rates of suicidality and tobacco use, HIV among some segments of the community. And as I'll share with you in a little bit, elevated rates of poverty too are a problem for LGBT people. And so given that I have access to data that most people don't, I can say that there are about 145,000 LGBT people in the state of Nevada. More than half are people of color, including about a third who are Latino and 1 in 5 who are multiracial. More than 1 in 5 LGBT adults in the state of Nevada who are over the age of 25 are raising children. Analyses of data that the state of Nevada collected between 2014 and 2017 and then stopped collecting on your state behavioral risk factor surveillance survey. Now, again, remember, I'm a researcher and I can access things that many people can't. We analyzed these data and found that 1 out of 5 LGBT adults in the state of Nevada were living in poverty before the COVID-19 pandemic. Nearly 2 in 5 transgender adults and 1 in 3 LGBT people of color in the state of Nevada were living in poverty. This is before the pandemic. Work that we've conducted at the Williams Institute, as well as others, indicate that the economic vulnerabilities experienced by LGBT people, particularly LGBT people of color, have been exacerbated by the pandemic. LGBT adults in the US were more likely to be laid off or furloughed from jobs and to report problems affording basic household goods, including and also difficulty paying rent or mortgage. For LGBT people of color, these economic challenges were heightened. At this point in time, we need LGBT data collection, SOGI data collection now more than ever. And as far as costs, I would say, I would not let the perfect be the enemy of the good or of progress. There are very good reasons to roll out SOGI data collection across systems, to do upgrades as upgrades are occurring naturally within systems, and to just consider including SOGI data collection part of usual sort of routine upgrades and maintenance. Thank you.
And
Thank you, Mr.
excuse me,
Chair.
and thank you for your presentation. I would get beat up by the committee if I didn't clarify, though, just the pronunciation of Nevada. And your presentation included so many Nevadas. I even feel awkward saying it, but thank you so much. And we're just having a little bit
I
of fun.
apologize.
No worries.
I'm so sorry. I'm a New Yorker who's lived in Boston and then California, so I'm totally mixed up.
No worries.
Thank you for the
We know that
opportunity.
that happens, so no worries. And we're just having a little fun. Thank you for joining us this morning. Senator, any other remarks or other speakers?
I've got a couple of people who are going to speak in neutral. Tina Dorch, who is the director of the Office of Minority Health and Equity. Also have Ms. Kyra, who is from DHS, and she deals with analytics to talk about how we can, excuse me, over the hump of what some people think will be a very costly effort. I also want to say that I did get a call from someone who was asking if this included if law enforcement stopped someone or if there was an encounter with law enforcement, would they have to ask? No, they do not. We're really talking about when you fill out any type of application or driver's license or whatever. That's when this would come into play. So it's not people on the street that have to ask about it. We're really talking about agencies that help and provide services to others. So with that, Mr. Chair, we will stand for questions.
Thank you, Senator, and thank you to your co-presenters. Members, at this time, we'll open it up for questions. I am going through the chat. I don't see any questions. We'll start off with Assemblyman Matthews, please.
Thank you, Chair. Thank you, and good morning, Senator. Thank you for the presentation on the bill. A question regarding two sections. Section 4, subsection 4, talks about the requirement to report summary of the data. Section 3, subsection 2, talks about the fact that various governmental agencies collect demographic information on race and ethnicity, and this is designed to kind of bring other communities into line with that. So I'm wondering, regarding Section 4 and the summaries, do we have requirements that summaries of this data currently be reported for information on race and ethnicity to LCB? And if so, could you talk through some of the things that are then done with that data once it's reported? Thank you.
Thank you. Thank you for the question, Assemblyman. Chair Flores, through you to the Assemblyman, I think that Dr. Conron explained how the data is used, but let me see if I can simplify it. Collecting data right now, we collect it on gender, we collect it on ethnicity, we connect it on age, we connect it on if they're trying to find out how many people are experiencing Alzheimer's, if they're trying to find out how many children we have who are on the autism spectrum. So we already collect that data. And just like that data is not connected to someone's name, they only want the numbers. And so the data will be used to make sure that our policies, number one, are informed for services, and number two, I hear a lot around the building where people say we leave money on the table because we don't pull down federal grants. This information will also help us pull down whatever federal grants are available to provide services for this community. And it will also provide an opportunity, give us an opportunity to apply for philanthropic grants, non-state related, non-governmental related, because generally they will ask, what is the population that you are trying to serve? So I think if I understand your question, the data will be used just like the data that is collected right now on gender, just like the data is collected right now on autism. We don't mention the children's name. Someone who's getting services for Alzheimer's, their name's not mentioned. There are no identifying marks. And so this data will simply fold in for the same purposes of the data that is already collected.
Thank you. Follow-up, Chair?
Follow-up, please.
Thank you. Section 3, subsection 3 has a statement that compared to the broader community, lesbian, gay, bisexual, transgender, and questioning persons experience disparities, and then it includes a number of different metrics, one of which is poverty. And I'm just wondering if you could just let the committee know what the source is for that claim and what the respective poverty rates might be. Thank you.
Thank you for the question, and I will get Dr. Conron, who is a noted researcher from UCLA, to answer that question, if that's possible. And this time she will say Nevada.
Thank you, Senator Spearman. We have analyzed data from the Nevada State Behavioral Risk Factor Surveillance Survey to provide information about poverty rates by SOGI. And I posted the SOGI data into the chat for everyone to see. I'm also happy to send along a copy of our report, which does include information about poverty rates for straight, non-transgender folks in the state.
And if I might add, for Nevada, I might add, just like in all research, there are several sources that academicians collect and combine that information from the various sources to get the information that reflects the most accurate picture. And so the data that she's talking about is data that has been collected. The data that is mentioned in Section 3 is really about the research that has been done that allowed us to make that statement. And so that's a collective research, but I think that the best answer to that is to look at Dr. Conron's research activities and what she has already quoted. For those who want to know and want to make sure that we're quoting accurately.
And Senator, if we could please ask, I know it was referenced that the information was shared on the actual link was put on the chat, but because we have this hybrid model, and I don't believe anyone here in the committee room is on the actual chat itself, I think the easiest way to get that information would be if you could share that with Ms. Judy Bishop or Mr. Jared McDonald, and then I could make sure that that link be shared with all the members in the room. Now, we can see the slideshow now, but I think it would be good if we could have that link shared with the committee policy analyst or our manager so that it can be shared with all the members. Thank you.
Thank you, Senator. Yeah, just want to make sure we know exactly what it is we're doing with this data. Thank you, Chair.
Thank you, Assemblyman.
It gets to you also. It can be uploaded on Nellis.
Thank you very much, Senator. Members, any additional questions? I don't believe I see any additional questions. Thank you, Senator, for your presentation, and thank you for your co-presenters. At this time, we'll go to those wishing to testify in support of Senate Bill 109. It is my understanding that nobody in the room is here specifically to speak on this particular bill. Is that correct? And so at this time, we'll go to broadcast. If we could please go to the phone lines, and we'll invite those wishing to testify in support of Senate Bill 109.
To testify in support of Senate Bill 109, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 671. Please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Good morning to the committee and to Chair Flores. My name is Gina Blackman Taylor, JeanaBlackman, and I sit on the Community Advisory Board of the Women's Research Institute of Nevada, otherwise known as WREN. We're based out of UNLV. I am here today to testify on behalf of WREN in support of SB 109. I'll keep my remarks brief, but I want you to know that in our research, when we use secondary data, we often find that items will be categorized by race or by gender, but rarely by both. Lack of such data causes us to miss systemic trends that often disproportionately affect women of color. We support Senator Spearman's efforts to expand data collection so that we have better tools for addressing systemic issues. I thank you so much for your time. Have a great day.
And thank you for joining us this morning. Next caller wishing to testify in support of Senate Bill 109.
Caller with the last three digits of 505, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
My name is Shelley Cooley, Shelley, last name Cooley, Cooley. I am a non-paid lobbyist for Nevada Justice Association. I am also a family law attorney, and we support SB 109. It is important for the state of Nevada to understand its residents, and collecting SOGI data is going to best help Nevada represent its stakeholders. I have nothing further to testify to.
And thank you for joining us this morning. Broadcast, next person wishing to testify in support of Senate Bill 109.
Caller with the last three digits of 747, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hi there. Thank you for the opportunity to testify in support of SB 109. My name is Dr. Jason Flatt. I'm an assistant professor at UNLV in the School of Public Health, and my research specifically looks to understand the needs of LGBTQIA+ people. And so I wanted to just speak about how important it is to collect SOGI data so that we can understand the health concerns of our population living here in Nevada. We know that LGBTQIA people face unique health disparities compared to their cisgender, non-transgender, heterosexual peers. We see this nationally. We see it with the data we have collected with the Behavioral Risk Factor Surveillance System data with the CDC. But currently, we're unable to really understand about the needs of Nevadans in terms of how is their health, how can we think about the unique needs of our communities who may be underserved. This includes those who may be racial ethnic minorities, who also identify as LGBTQIA+, or it represents people who cannot access some of the services. So for instance, here in Southern Nevada, we know that many of our homeless youth identify as LGBTQIA+, and we know that they're not able always to access services that they need or get support. So if we're going to really lead the nation in thinking about ways to improve health of our diverse population here in Nevada, it's vital that we collect SOGI data. I'm really excited for the opportunity to speak. I've been here in Nevada for over a year, and I'm currently leading work thinking about LGBTQIA+ people who are living with dementia, who may have Parkinson's disease. We're also thinking about the needs of people who may be at greater risk for COVID-19, but we haven't been able to really know about the potential concerns because SOGI has not been collected across the state. So I just really want to support this bill, let you know that we're doing unique work at UNLV School of Public Health to advance work for people who are LGBTQIA+, and I really hope that you will consider this bill and support it. So thank you so much.
And thank you for joining us this morning. Broadcast, next caller wishing to testify in support of Senate Bill 109.
Caller with the last three digits of 104, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Chair and members of the committee. My name is Maria Teresa Lieberman Barraga. That is MARIA-TERESA-LIEBERMANN-PARRAGA. And I'm here with Battleborn Progress, and we are in full support of SB 109, and thanks Senator Pat Spearman for this. And I will keep the rest short and say ditto to what previous folks and the presenters have said, and hope you all support this bill so that we can better serve a community that has often been ignored for so long. Thank you for your time.
And thank you for joining us this morning. Next caller wishing to testify in support of Senate Bill 109.
To testify in support of Senate Bill 109, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 653, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Chairman Flores, the rest of the committee. Good morning, Senator Spearman. Thank you so much for this bill. My name is Dora Martinez, DORA-MARTINEZ. I represent the Nevada Disability Peer Action Coalition. I do support this bill, ditto with the prior callers. As we all know, people with disability also intersect with LGBTQ plus population. Thank you very much and have a great Tuesday. Thank you.
And thank you for joining us this morning. Next caller in support of Senate Bill 109.
Caller with the last 3 digits of 766, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning. My name is Jay Capretta, and I'd like to thank Chairman Flores and the committee for listening to our testimony this morning. I'd like to thank Senator Spearman for bringing this legislation, as well as all of the other very hardworking, dedicated folks that have worked in the state of Nevada for the last 2 decades to change the laws in Nevada to protect all of us. I would like to draw our attention to the census numbers that came out yesterday, because this is exactly why collecting this data is so important. There are a number of states that have lost congressional representation due to a lack of counting of bodies. And so I would like to really urge the committee to support and pass this legislation, because without representation, we have no voice in the government or the laws that govern or change our lives, especially when it comes to social services, healthcare, education, all of these things. So thank you for the time and the ability to testify in support of this bill, and I look forward to seeing it move forward. Thank you.
And thank you for joining us this morning. Next caller in support of Senate Bill 109.
For the new callers, to testify in support of Senate Bill 109, please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Thank you, Broadcast. At this time, we'll invite those wishing to testify in opposition to Senate Bill 109. And we don't have anybody in person, so we'll go to the phones.
To testify in opposition to Senate Bill 109, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. And then we'll go to those wishing to testify in the neutral position for Senate Bill 109. I believe we had some folk who were going to join us via Zoom. Is that correct, Senator Spearman?
Yes, sir, that is. I think we have Tony George on the line, and then we have Kyra, I'm probably not pronouncing her name correctly, who can speak to the analytics part of the bill.
Understood. Thank you. So we'll take them in that order. And then broadcast after we get their testimony, we'll move back to the phone line. Good morning, Mr. George.
Good morning. Can you hear me?
My apologies. Yes. Please proceed.
Good morning. My name is Tina Dortch, D-O-R-T-C-H. I manage the Nevada Office of Minority Health and Equity, to refer to as NOMI or the office going forward. And I'd like to thank the chair and the vice chair, as well as members of the committee for your attention. I'll use my time to address how provisions of this bill support NOMI's mission, vision, and purpose. The late Assemblyman Tyrone Thompson reestablished the office by sponsoring the 2017 Assembly Bill number 141. His vision was reflected in the office's new name, the Office of Minority Health and Equity. Equity, when used in terms of health, means all people having the ability to attain resources at levels unique to them in order to maintain their optimal and overall well-being. Per Amendment number 163 to this bill, acknowledging a person's preferred gender expression reinforces their self-identity, has a positive impact on a person's mental health and thus their optimal and overall well-being. And as I mentioned, this is an objective shared by NOMI. With NOMI's name change came the intentional expansion of its targeted communities, with advocacy performed on behalf of all vulnerable communities, including SOGI demographics, in addition to those identifying as BIPOC. Adopting Senate Bill 109 is therefore in keeping with the intent of the late Assemblyman's wishes, and as it recognizes SOGI demographics to be a part of racial and ethnic demographics. Each April is a Minority Health Awareness Month. NOMI identifies themes that reflect our state's current health-related trends and equity-focused efforts for the next 12 months. One of the 4 topical areas high on NOMI's radar, as attested to in the governor's 2021 proclamation, is in fact promotion of increased data stratification to include things like ability status and SOGI-related demographics. By proposing the collection of SOGI data, including data points capturing gender expression, Senate Bill 109 aligns Nevada with national trends in collecting data, making national comparisons possible. And it also supports NOMI's efforts to upstream equity, making it possible to use data to develop culturally sensitive approaches. Put quite plainly, behavior is what we do, but culture is how we do it. And data collection per Senate Bill 109 would serve to document this statement. That concludes my remarks, and I thank you for your time.
Thank you. And we'll continue with those wishing to testify in the neutral position, and we'll stay on the Zoom.
I think Kyra Morgan, is she on?
Yeah, this is Kyra Morgan. For the record, my last name is spelled Morgan, and I'm the state biostatistician for the Department of Health and Human Services. I think Senator Spearman introduced this bill so well that I can almost just say ditto, but I did want to just briefly give my perspective as a biostatistician who's often asked to quantify impacts of either various diseases or even our social programs on subgroups of Nevada's population. We know that the characteristics of who we are and how we live determine in large part our health. You have probably heard of this as the social determinants of health, where you live, your socioeconomic status, in addition to your physical health, your demographic characteristics such as race, ethnicity, sex, age, and zip code. Along with this includes sexual orientation and gender identity. In order to best serve our clients, regardless of the organization we represent, we need to be able to first identify and quantify any disparities that might exist through data so that we can adapt the way we do business in order to have equal outcomes across our different groups. This bill would allow us to do that. We need to consider this variable for data collection as we would consider age or geographic region, for example, as a necessary descriptive demographic that is essential for us to collect in order to be able to deliver services to the best of our ability. Adding a field to a database is typically an easy add. It might incur a one-time charge for a vendor-based solution, but in general, it is not a difficult, technology perspective to add a field to a database. We believe that we're able to make these adjustments in the Department of Health and Human Services with very minimal cost, and I think Julia Peak is actually on the line to talk more about removal of a fiscal note from the Division of Public and Behavioral Health. And that's an organization which might even have the most disparate data sets that would be affected by this legislation. Here in DHHS, we're able to utilize probabilistic data matching across different disparate data sets to acquire information on our clients, where we might know the information in one place but not the other. For example, if we collected SOGI data, say for our Medicaid population, then we would be able to, with pretty high certainty, use that data to better understand clients across the board, because we know that the people we serve in one place are often the same people we serve in a number of other places. Regarding one of the questions from the committee on how we use the data, COVID vaccination distribution is a good example. We've identified that our Hispanic population are getting vaccinated at a disproportionately low rate. We've been able to host vaccination events in communities where we have large Hispanic populations in order to promote equity in those populations. These data would be able to be used similarly, again, just considered as a different demographic characteristic. And in general, I just wanted to close by saying that this bill is good public health policy because it is the logical first step in being able to quantify these disparities so that we can better serve Nevadans. And I'll close with that.
And thank you for joining us this morning. Senator Spearman, I don't believe we have anybody else on Zoom. Is that correct?
I believe that's correct, Mr. Chair.
Thank you, Senator. Broadcast, if we could please go to the phone lines for those wishing to testify in the neutral position for Senate Bill 109.
To testify in the neutral position on Senate Bill 109, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 294, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Chairman Flores and members of the committee, for the record, Callie Wilsey with the City of Reno. That's CALLIWIL, S as in Sam, EY. We are here in neutral today to ensure clarification was on the record regarding whether this bill would apply to situations when law enforcement is collecting data on their forms used in investigative processes. We not only appreciate the bill sponsor talking with us in advance of the hearing, but greatly appreciate Senator Spearman stating during today's presentation that that's not the intent. Our legal team interprets that the current bill language would mean that a police officer would need to ask a person about their sexual orientation and gender identity in situations such as a routine traffic stop or gathering information for a witness statement. We look forward to working with Senator Spearman and LCB on this clarification in the bill. We appreciate Senator Spearman's attention to our question and appreciate the opportunity to testify today. Thank you.
And thank you. Next caller wishing to testify in the neutral position on Senate Bill 109.
Caller with the last 3 digits of 271, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hello, this is Cy Bernabe, BERNABEI with Gender Justice Nevada. I am in support of this bill. I apologize, I was in the queue earlier. We need to collect accurate data about our LGBTQ community because it is critical in making sure our needs are better met. We need to be visible in the eyes of the critical programs where we experience health disparity. When the government collects data, it impacts the decision-making from the top to the bottom. To have a better understanding of the diversity of our community, it will greatly strengthen the fight for equality and access to healthcare. People are always asking how they can be a better ally, and it is this, taking action. Thank you very much.
And thank you. Broadcast, before we go to the next caller on the phone, I believe we have Ms. Julia Peak from the Division of Public and Behavioral Health joining us via video that wanted to testify in the neutral position.
Good morning. Thank you, Chair. I apologize for the confusion.
Good morning.
Good morning. On behalf of the Division of Public and Behavioral Health, this is Julia Peak again, P-E-E-K. I'm here to testify in neutral and just acknowledge the senator's efforts in this area. With amendment number 163, the division is able to remove our fiscal impact. As Ms. Morgan noted earlier, we do have to make modifications to many systems, though we see great value in doing this. We just needed extended time and the ability to apply for grants and incorporate these changes as we make normal changes to our IT system, specifically the vendor-based systems. And I'll just acknowledge that we don't know if there's disparity until we collect the data. So it's really important, as was noted earlier by Ms. Morgan and others, that if we don't ask the data, we don't know if disparity is present. And so we've done it with age, geographic, race, ethnicity, et cetera. And this just really needs to be incorporated across the board. So support the efforts, and we're very happy that we can remove the fiscal note and happy to provide updates on implementation in the future. Thank you.
And thank you for joining us. We'll continue with those wishing to testify in the neutral position on Senate Bill 109, and broadcast will go back to the phone lines.
To testify in the neutral position on Senate Bill 109, please press star 9 now to take your place in the queue. Chair, there are no more callers in the neutral position at this time.
Thank you. I just wanted to make sure that the record was clear. While we didn't have anybody call in opposition, we did have some folks signed in opposition, and if for whatever reason we weren't able to get to them on the phone, I'll make the record clear that Mr. Eric Spratley from the Nevada Sheriffs and Chiefs Association, Mr. John Jones from the Clark County District Attorney's Office, and Mr. Chuck Calloway from the Las Vegas Metro Police Department were all in opposition to Senate Bill 109. Signed in, but I don't believe they were registered to speak, but I just wanted the record to be clear on that. Senator Spearman, any closing remarks you may have at this time?
Thank you, Mr. Chair. And let me start by saying I have not heard from the people who signed in for opposition, but I am willing to speak to them about whatever concerns they have, and I'm sure that we can iron them out, and I can be reached via Zoom or telephone. So I would encourage them to contact me so we can iron it out. And I'm pretty sure that once they understand exactly what the bill is designed to do and what it will not do, I'm pretty sure we can take care of whatever those concerns are. First thing I want to say is that the bill acknowledges that everybody might not be able to get this done at the same time. So the amendment reflects that and says, as you can do it, please do it. The second thing I want to do is I want to highlight something that Dr. Conron said, and she said 125,000 members of the LGBTQ community is what the data that's currently here, what that shows. And 125,000 is half the population of Henderson, and it's more than the 57,000 people who live in Carson City. So you can see how large the population is right now, and I'm pretty sure once we collect the data that we will have more information. I said in my opening remarks that one of the places where LGBTQ plus people are discriminated against is in housing, and that's very important because there are many in the homeless population who are members of the LGBTQ community, and I think Dr. Conron mentioned that too in terms of teens, but we also have those at the other end of the spectrum, and that is our elders. So we have to make sure that whatever we're doing policy-wise in terms of homelessness, that we are including those considerations as well. I think that, and it struck me last night as I was thinking about this, that next week will be the second anniversary of Assemblyman Tyrone Thompson's departure. And I thought about it because I was thinking about the Office of Minority Health and Equity, and he worked so hard to get that done and to make sure that it was funded. And as I thought more about it and thought about Soji, I thought to myself, he's got to be pleased that we're not only picking up where he left off, but we're also expanding the application of his efforts. And so many more people, they may not know his name, but they will certainly know his impact. And with that, Mr. Chair, I want to thank you and the committee for hearing this bill. Thank you.
And thank you, Senator. And I'm confident that you'll have an opportunity to speak with those registered in opposition, and I'm sure we'll be able to get to a place where we're all comfortable. Again, thank you for your presentation, and to your co-presenters, thank you all for joining us this morning. With that, we'll go ahead and close out the hearing on Senate Bill 109. And I do see our senator here present. And we'll open up the hearing on Senate Bill 222. Good morning and welcome, Senator, whenever you're ready.
Thank you so much, Chair Flores, and good morning to the Government Affairs Committee. My name is Melanie Scheibel. I represent Senate District 9 in Clark County, and I'm in the enviable position of getting to present to you SB 222 with a high-level overview, and then I have somebody much smarter and more dedicated than me named Eric Jimenez to present to you the sections of the bill and answer all of the hard questions. So let me first just give you an overview of what SB 222 does. It establishes diversity liaisons within government agencies. It is in large part a permissive bill. It does not require that every single agency in the state hire somebody new, but it does require that agencies that have the capacity to either designate or hire a diversity liaison, which means this could be a newly hired person, or it could be somebody who's already working within that agency to be designated as the diversity liaison, coordinates with a couple of key offices in the state of Nevada to ensure that we are meeting the needs of every population of Nevadans. One of those is the Office of Minority Health and Equity, which we just heard about from Senator Spearman in SB 109, and as you all are well aware by now, is an important part of the Nevada government that ensures that everybody in Nevada is receiving equal access to health care, opportunities under the law, and is being treated with respect and dignity. So the point of SB 222 is to ensure that in every agency there is a point of contact, a person who is responsible for ensuring that our government agencies are meeting the needs of every Nevadan. So that could mean that somebody has a disability and needs access to a website or a meeting that isn't currently accessible to them. It could mean that members of a minority group have recognize that there is terminology still being utilized in the state that is offensive or outdated. It could mean that there is a group of people who has been systematically excluded from a conversation and they want to be included. What SB 222 does is it says that there will be a person in the Department of Education, there will be a person in HHS, there will be a person at the legislature who is the point person for that issue. And that person will be tasked with communicating with those groups. It might mean holding stakeholder meetings, it might be reading a letter, it might be having a phone conversation. And then I think one of the key elements of SB 222 is this yearly meeting that the Office of Minority Health and Equity and the Commission on Minority Affairs and the Office of New Americans would convene to have all of these diversity liaisons in the same place at the same time, whether that is physically or in the future via video, to allow them to converse with each other and say, here's what worked for us, here's what didn't work for us, here's something that we experienced that people in Nevada need, and we were able to provide for them. So that we provide people who are looking for a better relationship with their government, a path to establish that. I think that is the high-level overview. As I said, I am lucky to be joined by Mr. Jimenez, who can walk you through the sections of the bill and answer the hard questions. Bye.
Thank you, Senator. Mr. Jimenez, it's great to see you in person as well as you, Senator Scheibel.
Mr.
Feels
Chairman,
a little bit slightly better normal now.
It is so exciting to be back in the hardworking Committee on Government Affairs. The hardest working committee, I believe. For the record, my name's Eric Jimenez. I'm actually not here on behalf of the Treasurer's Office today, but I have the privilege of serving as the chair of the Advisory Committee for the Nevada Office of Minority Health and Equity. Senate Bill 222, as Senator Scheibel kind of went through, is a very simple bill, but I think it's critically important. And where it came from is Senator Spearman and Governor Sisolak both issued resolutions and proclamations outlining that racism was a public health crisis. And our office, the Office of Minority Health and Equity, was tasked with coming up with strategies to ensure that we could combat racism and make sure all members of the community were able to have their voices heard. In the midst of that, we were also seeing a global pandemic where I think it should come as no surprise to anyone here that members of minority communities were getting absolutely decimated and were struggling to access services. And I think, from a government perspective, we have a responsibility to do the best that we can to meet people where they are. And sometimes, although well-intentioned, decisions are made in Carson City that affect minority communities, but the input of those minority communities isn't taken into account. So this committee may recall, in the last legislative session, there was Assembly Bill 264 from Assemblywoman Peters. And that bill has been tremendously successful establishing tribal liaisons. What this bill is attempting to do is to take that one step further and say, how can we ensure that all of our minority communities are having their needs met? So with that, I'm happy to walk through the bill, Mr. Chairman. It's a pretty short bill. It's up to you. So sections 3 through 8 of the bill are purely definitional sections. And I would note the definition of minority groups is based off an existing one in statute in that particular chapter. Section 9 states that state agencies should make a reasonable effort to collaborate with minority groups in their policies and programs that directly affect them, ensure that programs offered by the state agency are accessible and inclusive. And I think this particular piece is tremendously important. I know there might be a few folks from our blind community who are on the phone. You may not know this, but many of our websites, even state legislation, are inaccessible to the blind. And I think it's important that we make sure that our services are accessible to everyone. And then finally, state agencies should make information about their programs and services available in multiple languages. Section 10 has state agencies, when they can, designate a diversity and inclusion liaison, which would be that point person that Senator Scheibel mentioned to serve as a contact person for minority groups. Section 11 is very simple. It just simply says that that agency should make the contact information of the liaison available and then provide that information to the 3 agencies who do this work every day in the community. And then finally, and I think this is the most critical piece of the bill, Section 12 requires a joint meeting, a collaborative meeting between all of the agencies. I think too often we exist in silos between state agencies, and oftentimes there's some very good work that is being done. And when we think about what we're going to need to do to break down the barriers that minority communities face and how we work to address systemic racism, it's really going to be an all-hands-on-deck effort. And this meeting that would be organized by these 3 agencies is critically important to making sure that happens. And with that, Mr. Chair, that's all I got. So happy to take any questions.
Thank you, Mr. Jimenez, and for acknowledging that it's the hardworking Committee on Government Affairs. The members committed to not drilling you too much. Members, any questions? We'll start off with Assemblyman Ellison, please.
Thank you, and thank you for going through the bill. Question I've got is, what do you do with these little bitty mom and pop outfits that's got 1 employee or 2 employee? For number one, you can't find employees right now, period. But say you got such a small shop, how would this bill affect that?
Thank you for the question, Assemblyman. It wouldn't. This is affecting state agencies, not businesses. But for the smaller agencies, and I think it reflects this in the revised copy of the bill, I believe there's no fiscal notes on the revised copy of the bill. It's just saying that one person from, if there was a smaller agency, and I would note that the agencies listed in the bill, the Office for New Americans, the Commission on Minority Affairs, and the Office of Minority Health and Equity are some of the smallest agencies in the state or offices, and they have all been super supportive and great to work with on this bill.
All right, thank you.
Mr. Jimenez, we still need you to state your name for the record each time. Otherwise, we're, you get 1 pass, though, because of your comment with the intro. Members, questions? Next, Assemblyman Matthews.
Yes, thank you, Chair, and thank you, Senator. Thank you, Mr. Jimenez. Just a point of clarification. When the bill refers to minority groups, that's intended not to mean groups as in a formal or incorporated organization necessarily, right? It could also mean using the word groups in sort of the informal sense as well. Is that correct?
I believe that's correct, Eric Jimenez, for the record.
Okay, thank you. I just noticed in section 4, subsection 1, spells out the definition then of minority group. And C says a group of persons that share the same sexual orientation. And then further in subsection 2, it says it uses in this section, sexual orientation means having or being perceived as having an orientation for heterosexuality, homosexuality, or bisexuality. In a plain reading of this, I think you sort of touched on this, but that would seem to suggest that it would include members of the heterosexual community as part of that definition of minority group when you take sub 1C and then sub 2 together. And it's entirely possible I'm missing something, but with subsection 2 being very broadly encompassing, it just seems that it conceivably this could make almost anyone a part of a minority group. But please, I may be reading it wrong, so please correct me if I am. Thank you.
No, I appreciate that, Assemblyman Eric Jimenez. For the record, this definition of minority group is the same definition that's in the statute in 222 for the Office of Minority Health and Equity, which I believe, and LCB Legal can correct me if I'm wrong, was the provisions of Assemblyman Thompson's bill in 2017. So the intent of this bill is to make sure that racial and ethnic minorities, that people with disabilities, and then members of our LGBTQ community are included in that. The way I read the section, Assemblyman, I think it actually goes with that intent. However, if there is any clarifying language needed, we'd be happy to do that.
Yeah, thank you. Yeah, I just want to make sure that something isn't misconstrued or used for a purpose that isn't consistent with the intent. So thank you for that, and thank you, Chair.
Thank you. And we'll have our legal jump in, and I'm sure she can give some clarifying guidance here. Thank you.
Erin Sturdivant, Legislative Counsel Bureau. The definition is found in existing law, but it does seem to include people who would identify as heterosexual under the existing definition. So it's certainly something we could clarify in the bill.
And Eric Jimenez, for the record, we look forward to bringing you a very minor amendment, Mr. Chairman.
Thank you, Mr. Jimenez. And I know there was multiple members that echoed that specific question, so thank you, Assemblyman Matthews, for spearheading that. Next, we'll go to Assemblywoman Anderson.
Thank you, Mr. Chair, and thank you for bringing forward the language. Really, first of all, before the language is really asked about, appreciate the work that you all did with removing the fiscal notes. I realize this is not a committee that looks at that, but obviously there was some significant work if you take a look at that first set of fiscal notes to what it is now. My largest question has to do with something that was touched upon by both the senator as well as by you, and that has to do with the designation. I'm concerned that we're going to be putting one more thing on somebody's plate when, as many of us know, many of our state employees are incredibly overworked. So would this be a voluntary decision to make? Because also I don't want to have somebody be assigned this role, because this is something that is very important. And if it's somebody that's assigned to it as opposed to chooses to volunteer to be part of it, I guess I'm just asking for that process and whether or not this is somebody that's going to be hired or if it's a designation that is currently of individuals that are currently employed in the different agencies.
And thank you to the Assemblywoman from District 30, Eric Jimenez, for the record. I think this is a really good question. I think it's great to clarify this for the record. As the bill was originally drafted, there were sections of the bill that said that the individual who was designated had to report to the director of that agency in conversations with agencies that may not have been feasible. So the goal here is how can we continue on the good work that some agencies are already doing. How can we expand that work to other agencies who should be doing this work? I don't want to speak out of turn, but I think from some of the members on this committee, there should be a commitment to serving minority groups from state agencies, and I think it's important work. But also, we understand that there's a lot of resources, and state agencies have been asked to make cuts, and we love our state workers, and they're often asked to do more with less. So that's why we put that language in there to the extent possible. Understanding this is just a starting point, and I think this is a really good point to kind of start this conversation. but it's really important that we have a framework and a space for these conversations to happen at an agency level. Oftentimes, members of the legislature will bring bills that are well-intentioned, but sometimes those agencies aren't kept in the loop, and then it puts a fiscal note on the bill, and a really good idea that would move progress forward dies. I think if we're able to utilize this right, we might be able to get some agency buy-in to really help these communities.
Follow up, if I may, Mr. Chair?
Please follow up.
Thank you. Thank you for that clarification. And I think you understood where I was coming from with it, because we don't want to have somebody that is assigned this very important role and then goes to this yearly conference, for lack of a better term, meeting, and basically doesn't do anything to help move forward. So I really appreciate that this is just the beginning of one of many steps, and that. So would the directors be the ones that are in charge of, like, 3 people, let's just say in one area, 3 people are like, I really want to be this person. Would the director make that decision, or would that decision be made at a different area, or is it completely up to each separate agency?
Eric Menace, for the record, I think that would be the agency head that would make the decision on who the person was, because they know their agency, they know their budget, right? I think just as someone who serves as his agency's tribal liaison, I think it varies from lower level staff to higher level staff. I think agencies should be making that decision based on the programs they have, and there might be an individual who's like really hitting the pavement doing this work, or an individual who recognizes that there are gaps and wants to do that work as well. So I really think it should be made on an agency by agency basis, and I think this bill reflects that.
Thank you for that clarification, and thank you, Mr. Chair.
Next, we'll go to Madam Vice Chair.
Thank you. Thank you for the presentation, Senator and Mr. Jimenez. It's always good to see you. So I'm looking at the definition of sexual orientation, and while I understand that the definition of sexual orientation here is what's in other parts of the statute, I think that this definition of sexual orientation is just inherently exclusive. And so I'm just wondering if there's been conversations about kind of making some changes to this definition, which only includes heterosexual, homosexual, and bisexuals.
Assemblywoman, thank you for the question, Eric Menace, for the record. Senator Shively and I were actually just talking about this. I think the intent here, along with Assemblyman Matthews' point, I think would be to clarify and be a little more inclusive and modern in our definition. So I think you'll see that in an upcoming amendment. But I would just, one thing I would caveat, if we're thinking about changing the definition of minority group, in this particular section in statute, we may want to look at either now or down the road, changing the other definition in that same statute to reflect that as well.
Thank you. I appreciate the answer, and I think it's about time that we make those changes in the Nevada statute.
Members, any additional questions? Seeing none, thank you both for your presentation. And at this time, we'll go to those wishing to testify in support of Senate Bill 222. I am checking now to see if we have anybody wishing to testify via video. I believe we do have somebody via video. Mr. Wade? Is that right? Good morning, please.
Good morning. And thank you. Good morning again, Chair Flores, Vice Chair Torres, and members of the committee. Again, my name is Andre Wade, ANDREWADE. I am State Director for Silver State Equality and a member of the Nevada Office of Minority Health and Equities Advisory Committee. But today I am briefly testifying in support on behalf of Silver State Equality. We are in support because this will help build capacity for the office, which is really important given the few number of staff that support the office and the growing need to expand our diversity and inclusion efforts. And so with this, we'll be able to weave in our diversity, inclusion, and equity efforts throughout the state, sort of enshrining this work that we do to ensure that these minority groups are thought of. And again, it'll also increase accessibility and inclusion across the board, which is severely important, especially to those who are differently able. So again, in short, we are in support, and thank you all for your support in advance. Thank you.
And thank you again for your testimony and joining us. We'll continue with those wishing to testify in support of Senate Bill 222. Ms. Tina Dirch, my understanding is that you're going to be testifying in the neutral position, is that correct? Or in support?
I'm in the neutral position, Chairman.
Okay, perfect. So we'll come back to you after we get done through support and opposition. So at this time, we'll go to the phone lines broadcast and those wishing to testify in support of Senate Bill 222.
To testify in support of Senate Bill 222, please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Thank you. At this time, we'll go to those wishing to testify in opposition to Senate Bill 222.
To testify in opposition to Senate Bill 222, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. And at this time, we'll come back to our Zoom for those wishing to testify in the neutral position. Ms. Dirch, please.
Thank you again. Thank you again, Mr. Chair. Again, my name is Tina Dorch, D-O-R-T-C-H, and I manage the Office of Minority Health and Equity. I'd like to thank the committee for your attention, and a special thank you to Mr. Jimenez, who serves as chair of the advisory committee. I'll use my time to address 4 provisions of Senate Bill 222. First, the bill's proposal that, to the extent practicable, diversity and inclusion liaisons be designated within state agencies that, per Section 10, interact with or offer programs and services affecting minority groups. This will serve to ensure equitable consideration related to impact on minority groups being applied at the earliest stages of agency-level decision-making, program development, and resource allocation. Second, per its amendment number 65, the bill's proposal that NOMI, the Commission on Minority Affairs, and the Office of New Americans collaborate as aides to these liaisons. This will serve to promote awareness and the existence of the role of these liaisons, a function that's required by Section 10 of the bill. Furthermore, the amendment ensures that these liaisons are sufficiently supported so that their respective agencies are able to, quote, collaborate with minority groups on these policies that affect minority groups and ensure that these programs are accessible, end quote, as read in Section 9. And then also in Section 11, each of these 3 agencies, including my own, will be posting the liaison's contact information on our respective web pages, which will further ensure a broad and more diverse outreach. Third, because the collaborative facilitation approach has been adopted through the amendment, participation in the annual meeting between the diversity liaisons and these minority advocating organizations will be highly stratified and inclusive. For example, by virtue of the assistance of the Commission, given its multifocal issue areas, advocacy groups across health determining sectors within housing, education, employment, economic and workforce development will be identifiable. Likewise, because of the assistance of the Office of New Americans, advocacy groups representing immigrant, undocumented, as well as citizens, newly identified citizens will be brought to the table. And then for NOMI's role in planning the annual meeting, in addition to identifying entities focused on BIPOC communities issues of accessibility, should the passage of Senate Bill 341 take place, which proposes that the Office of Minority Health form joint public-private partnerships, NOMI would then be able to identify additional strategic allies. Fourth, as part of the jointly produced annual report summarizing the impact and effectiveness of these liaisons in conducting their duties, which are outlined in Section 10, NOMI and the Commission and ONA development of recommendations will present on an annual basis agency-level opportunities to improve communication between agencies and minority populations, the availability of adaptable accommodations throughout agencies, and the use of culturally competent methods for service delivery. So in closing, Senate Bill 222 reflects a commitment to embed internal and public-facing equity checkpoints throughout state government. And by assigning the support of the proposed to the DI liaisons across 3 agencies and commissions with relevant missions, a sustainable network will be in effect created. That concludes my remarks, and thank you.
And thank you. Broadcast, if we could go to the phone lines for those wishing to testify in the neutral position for Senate Bill 222.
To testify in the neutral position on Senate Bill 222, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 678. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Chair Flores, Vice Chair Torres, and members of the committee. For the record, I'm Sharina Diaz-Cis, CHARINA-DASIS, the Director for the Governor's Office for New Americans, testifying in neutral for SB 222. The Governor's Office for New Americans was created to ensure the civic and economic integration and inclusion of immigrants and refugees in the state of Nevada, which accounts for about 20% of the population of our state. As part of our job in making Nevada more welcoming to this population, we are actively working towards collaborating with agencies throughout state government to ensure immigrants and refugees are being served adequately, and that as a state, we provide them the best opportunity to succeed civically, economically, and socially. The intent of SB 222 aligns with the mission and vision of the Office for New Americans in making Nevada a more welcoming state for immigrants and refugees by requiring, with certain exceptions and to the extent practicable, a state agency to designate a diversity and inclusion liaison. It will facilitate an even more efficient process to address issues that our constituents sometimes encounter when interacting with state agencies. It also provides an opportunity for proactive collaboration to ensure that programs and services offered by state agencies are accessible and inclusive to immigrants and refugees, especially those who are limited English proficient, and helps us identify gaps of services and duplication of efforts. Furthermore, an annual meeting in collaboration with the Office of Minority Health and Equity and the Commission on Minority Affairs and the submission of a report to the Governor and the LCB will keep the state accountable to make attempts to serve all Nevadans, including the immigrant and refugee population in the state. Thank you so much for your time, and I appreciate it.
And before we get you off the phone line, I believe we do have a question for you, Madam Vice Chair.
Thank you. And this question is for the Director of the Office of New Americans. And so, I've had a lot of conversations with the Office of New Americans about all of the different projects and work that you have done in our community. And I understand that the office is rather extended and that we're having difficulty just keeping up with the workload that we have right now. So I'm just trying to understand whether or not the Office of New Americans will be able to do this new additional task when we've been kind of strained, just to keep up with the responsibilities that the office has right now, and how we're able to do that without having some type of fiscal note.
It would actually, this one will actually just solidify what we are doing. We are currently really working with agencies when some issues come up, and having a diversity and inclusion liaison will just have a specific person to pinpoint, and not for my office to scramble around looking for who to contact for this, or who to contact to change a language in a website, which we have been doing. So it just makes our process a little more efficient. We are already doing some of this, and this SB 222 will just help facilitate kind of like an easier collaboration with other agencies.
Thank you.
Members, any additional questions? Seeing none, thank you for joining us this morning. We'll continue with those wishing to testify in the neutral position on Senate Bill 222.
Caller with the last 3 digits of 653, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Chairman Flores. This is Dora Martinez. I was calling in support of SB 222, but I had some issues. May I proceed, or do you want me to call back?
No worries. Please proceed. Just make sure, let the record reflect that we are in support. Please continue.
Thank you so much for your understanding, sir. Good morning, everybody. Good morning, Eric Jimenez, the able guy. I do appreciate this SB 222. This bill will allow people with disability, such as myself, I am a blind parent, to not have a burden on myself. As you all know, distance learning with the school district, some of the websites with the Washoe School District is not accessible for people who are blind, and the district does not have a grievance form. And so having this moving forward will help us, help them be educated on how to deal with their website, and not just the Washoe County School District, but also the healthcare services. I know that because it's not accessible fully, and some of the police department. So thank you so much for moving this forward. Thank you to Senator Scheibel. I hope I pronounced her name right. I really do appreciate this. And please, if you all need assistance, we are here. We are the expert. We might just go for a cup of coffee, and that's enough payment. Well, for me, I'm not speaking for anybody else. For the record, just for me. And Eric, I can't wait to see you and have Sarge come up and say hello. Thank you so much. Take care and have a great day.
And thank you for joining us. I know that some folk often have a difficult time just trying to log in. It's normal with Zoom. So again, we appreciate you joining us this morning. At this time, we'll go back to the neutral position. Broadcast, next caller wishing to testify in the neutral position, Senate Bill 222.
Chair, there are no more callers in the neutral position at this time.
Thank you. And at this time, we'll go ahead and come back to either our senator or Mr. Jimenez, if you want to join us for any closing remarks.
Eric Jimenez for the record, Mr. Chair. I don't get the opportunity to embarrass my friend from District 9 enough, but just want to say thank you for her leadership and for her commitment to making sure that populations that don't often get heard and have a seat at the table. Thanks.
And thank you, Senator, again, and Mr. Jimenez. We look forward to those amendments and working alongside of you to get this bill exactly where we want it. With that, we'll go ahead and close out the hearing on Senate Bill 222. And at this time, we'll invite those wishing to join us for public comment. I want to remind those of you who will be joining us for public comment that this is not a time to reopen a hearing, but rather for you to speak about general matters that fall within the purview of this committee. Also, I ask that you remain respectful. Broadcast, if we could please go to the phone lines for those wishing to join us for public comment.
To take place in the public comment queue, please press *9 now. Chair, the public line is open and working, but there are no more callers at this time.
Thank you. We'll go ahead and close out public comment. And at this time, I'd like to remind members that we'll be meeting tomorrow morning at 9 a.m. And for tomorrow's agenda, we have Senate Bill 127 and Senate Bill 237. Please give yourself an opportunity to review those ahead of time. And with that, members, thank you for all your questions and today's dialogue. This meeting is adjourned.